The number of junior doctors actively researching leaving the NHS is rising at alarming rates, with over 79% reported. That's according to new data from the British Medical Association. They've done a survey. Well, preparing to ballot on strike action over pay, medics are following closely behind nurses and paramedics who carried out industrial action for the first time in over 100 years this month. Well, let's hear more now from GP. Dr. Natalie Rout can join us now. Thank you for the time this afternoon. I suppose, first of all, this is not particularly surprising to people who know GPs. Anecdotally, I know a number of people who've been looking at opportunities in Australia, in the United States of America, in Europe. Should we be surprised by this survey?
Well, I'm certainly not surprised. Junior doctors form the majority of the doctor-led workforce. I think they're misnamed as juniors. Basically, any doctor under consultant level is a junior doctor. So these are the people that are delivering your babies, that are doing your operations and doing everything in the hospitals in A&E as well. So the fact that this huge proportion of them are considering leaving the NHS just shows how dire working conditions have become. We keep talking about the NHS about to collapse, but it's already collapsed. A&E is over, you've got wait times of over 10 hours in places. Bed capacity is already struggling across all hospitals. GPs, you're having to wait for weeks to see your GP because there are a shortage of us. And actually, in a survey from GPs recently, 42% of us have been thinking about leaving the profession. So the NHS is really struggling at the moment, and we need to take these statistics seriously.
Yes, it's clear for anyone who's tried to use NHS services in the last couple of years that things are really stretched. But what's extraordinary is looking at the inputs rather than the outputs. The NHS has never had more money. It's never had more money compared to the population size. It's never had more money when adjusted for inflation. The budget for the NHS has risen by 40% in the last 12 years. Why are the tens upon tens upon tens of billions of pounds extra that have gone into the NHS? Why has that not made things better?
Well, I think you also have to understand that demand is outstripping supply. So our patient population has grown. The complexity of our patients is growing. We have an aging population, which means that people need more complex healthcare. They need more time. And so actually there's a lot more demand for services that no matter how much money you throw at it, we need more staff to actually provide those services. And that money isn't going into the pockets of our nurses and our paramedics, our junior doctors. It's going into other areas, but still there's so many things that need fixing, like the IT systems in the NHS. I'd like to know where this money is going. But even with that much money, we can't cope with the demand that our public needs.